Hi, and welcome to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation focused on youth mental health. Before we begin today's episode, I just wanted to let you all know that all content that is found in our podcast is created for informational purposes only. This content is not intended to be a substitute for professional medical advice, diagnosis, treatment, or therapy. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something you have heard in this podcast. Thank you so much, and without further ado, let's get started.
Hello, everyone. Welcome back to another episode of Mindful, Beautiful, and Thriving. It's your host, Punam here, with a very special guest, Dr. Leena Khanzode, the founder and president of Tharika Foundation. This podcast is made possible because of her. Today's podcast is recorded to celebrate International Women's Day. It is a global day celebrating the social, economic, cultural, and political achievements of women. Welcome back, Dr. Leena. Can you please introduce yourself for those who are listening to you for the first time?
Thank you, Punam. It's an honor to be back on the podcast. I know I have been not doing any more recordings and have invited other guests to hear other experts and share their opinion. So it's an honor to be back. As Punam mentioned, I am Dr. Leena Khanzode. I am a child and adolescent and adult psychiatrist. And I have a private practice in Los Altos. Besides that, I'm a founder and president of this nonprofit called Tharika Foundation, whose mission is to create youth mental health awareness. And it is really exciting to talk about the different hats I wear today as a woman in the light of upcoming International Women's Day.
Thank you, Dr. Leena. So, how are you planning to celebrate International Women's Day?
So, Poonam, I have been invited to be part of an International Women's Day Sawyer. They are actually doing a women empowerment event to support the other nonprofits in the community like Narika and Maitri, who are more focused on women empowerment. And so it's been a pleasure and an absolute honor to be part of a women empowerment panel that will be happening in that event on March 9th in Sunnyvale. This is being organized by Bollywood Dance Connection and Siksha, Connect to Your Roots. These two organizations have been instrumental in bringing community together for various different events and always conduct a thoughtful event and have been very supportive of the work Tharika is doing. And through that connection, I was also invited, and I'm looking forward to being part of this panel with other awesome women on March 9th.
Wow, that's great. I'm also celebrating by attending a women conference at work. So I'm also looking forward to celebrate women's achievement. So Dr. Leena, I am very happy to see women progressing in all areas of society. However, I'm also concerned about the increase in mental disorders. As per the latest stats, 26% of young women experience a common mental disorder such as anxiety or depression, almost 3 times more than young men. Could you please share why women face such disorders more than men?
So yeah, the data is pretty accurate and it's pretty concerning at the same time that we are seeing much higher rates of these mental health conditions in women than men. There have been certainly very many different factors that make women more prone for having mental health conditions like anxiety disorders and depression, post-traumatic stress disorders, and other type of anxiety disorders. The biggest factor is the biological difference because of the hormones. We certainly have protective effects from our estrogen, but there is also a shift that happens around perimenopause, menopause, that the estrogen levels start to decline, and that protective effects do make a difference, not just in our physical health, but also make us more prone for mental health conditions. Besides that, there have been certainly other factors that have been identified. The social cultural factors are, as you understand, again, culturally, there can be many, many different ways to factor in how women's mental health is considered to be valid or invalid at times. There is certainly greater stigma. It's interesting how women actually have difficulty talking about their mental health straightforward, and they actually have to often say they are having physical symptoms, and then they come to the doctor with a lot of physical somatic symptoms, as we call them: headaches, stomach aches, body aches, back aches, and then turns out there is also underlying depression that's brewing. There is also trauma often that as women we tend to be more vulnerable to. Again, being just in the hierarchy of male dominated world, often women are the victim of trauma because of sexual assault or domestic violence. Also the roles we play. I mean, we wear multiple hats. We are playing a role of a professional at work. We are being a mother. We are being a homemaker. We are being a spouse and partner and a daughter and a daughter-in-law. I mean, talk about the roles, right? And so that definitely takes a toll on us. And if we don't practice good self-care and take care of ourselves and balance those roles, that definitely puts us at a higher risk. And then the stress of being in the modern world we are in certainly has been a big factor. The social media, the number of things we have to upkeep with these days can be also an additional factor why we are more prone.
Thank you so much, Dr. Leena, for educating us. So, do you see any gender differences in seeking, receiving mental health services in your practice?
I do. It's improving, I must say. It's definitely better than it used to be. I have been in practice now for 12 plus years. And like I said, a lot of the times, initially, I would be working with a child and the mother would be having a lot of physical symptoms and not being able to take care of the child. And then it, like, after understanding and exploring the history and talking to the family, it would be like, oh, mom's probably dealing with her own mental health struggles, anxiety and or depression. But it has shifted that there's been heightened awareness, reduced stigma. There has been a shift where moms, in my practice at least, or even other times when they are coming directly to seek help, are able to talk about, like, oh, you know what, I think I'm also dealing with something, and so can you suggest somebody to talk to? But besides that, I would say we are not there where we need to be. There are still a lot of factors that play into why women tend to take a step back from seeking mental health treatments. There is a lot of stigma, and culturally in South Asian community, it's still quite there. There is concerns about, like, what does it mean to be on medication and therapy, and there is access that's limited because a lot of providers are not contracted with your insurance, and the burden of the cost paying somebody as an out-of-network provider can limit people. And then you need to find time. There is definitely, as I was mentioning, as women, we play so many roles. We get strapped with doing all the other things and put our self-care or our care in the back seat, which is why this is so difficult for women to carve out time or even focus on themselves and talk about it. Versus for men, I guess, again, not trying to be gender biased here, but women tend to be emotionally more mature and stronger. So often they can deal with stuff longer and don't feel like they need to get help. The help-seeking behavior that we see between men and women is different, that women tend to to tolerate more, to endure more, and then really reach for help when they are really, really struggling, which I think seems to be different for men. Often they tend to get help sooner as soon as they're noticing a distress.
That's very interesting, Dr. Leena. I thought like when I was growing up, men they are supposed to be stronger, even though they have issues they won't express. And I'm also a mother of a boy and a girl. I do see that my son doesn't like to express his feelings. So he has that perception of masculinity. And while my daughter, she's comfortable talking to me, whatever she's feeling. So definitely, I feel there are differences as you were explaining, but I would like to know what are there any barriers to accessing mental health care services among women? You mentioned few, but other
Mhm.
than like what you mentioned, do you see any other barriers?
Yeah, of course, I talked a little bit about the financial barriers with a lot of services not being available through your insurance or having long wait to get through, see your in-network or insurance provider. But besides that, I think even though that's been improving, I would say, at least I can speak for our area, there's a lot of nonprofit agencies who have now started contracting with insurance panels and have started providing care that is more accessible. There are other factors like lack of awareness and education about even recognizing what I'm going through is actually anxiety or depression. There is a stigma and shame around getting to see a mental health professional. There are other responsibilities of the family and the roles we play that put us in the back seat. There are also language and cultural barriers. Often victims of trauma find it even harder because it takes a lot of extra effort to work through some of those issues that have been driving their symptoms. So there is a lot of intersecting factors. There is differences in terms of socioeconomic status, your sexual orientation, your ethnic background, your race. There's like so many factors actually that make it much more harder for women to access care.
Yeah, thank you, Dr. Leena. But I do believe Tarika Foundation is doing a great job educating everyone, including parents, teens, to take good care and be aware of all these mental health issues we are talking about. But I wanted to ask you, what can be done as preventive care for women so that these stats don't go up?
One of our mantras at Tarika is prevention is better than cure, which is why we do educational podcasts like these. We have YouTube channel, we have TikTok. We are trying to appeal the youth by going to social media platforms like Instagram and TikTok also. So we have certainly focused on education and awareness, which is a very important prevention, I guess, step. Besides that, I think we need to focus on self care. I think I talk about this formula of stress is equal to pressure divided by resilience. This is what our life has become. We have put a lot more pressures on ourselves. And in order to meet those pressures, the roles and demands that we play because of different roles, particularly as women, we are tapping into our resilience building factors like getting adequate sleep, getting the right nutrition, getting exercise, not just exercise for body, but exercise for your mind. So what's been happening is the resilience is starting to go down and the pressures are mounting. And so we are getting stressed out. So if we can catch ourselves during that stage of not getting stressed out or being stressed out, that is where the money is. So self-care practices like exercise not just physically, but for your emotional health, meditation practices, or finding outlets that are meditative for you. Some people say, I can walk and that's meditative for me. I can listen to music and that can be pretty powerful for me. I can practice singing or dancing and that can be my outlet. I can do art. Um, I can just hang out with my girlfriends, and that peer support can be huge to reduce stress and anxiety. I can join support groups. So there's many different ways you can listen to educational podcasts, read books that are more healing and giving you ideas to manage stress better. Really finding that right balance between work and life, which is an ongoing delicate dance we all have to do, but that's what we have to continue to work towards and find that sweet spot. So yes, I think cannot emphasize enough the importance of me time and self-care as prevention strategies.
Thank you, Dr. Leena. And you talked about even social support, and I do believe Tarika Foundation is doing great job. We are bringing people together during our five senses art workshop, right? In the nature, parents are invited, kids are coming. So I do believe during COVID we might not be that much connected, but now COVID is over. So I feel it's a great idea to have more social connection, and it definitely does boost mental health. And during our conversation, you talked about meditation. So I wanted to ask you, is mindfulness helpful in treating mental disorders?
Yes, absolutely. So that is my passion, and that's one of our focuses of introducing stress management and prevention of stress related disorders at Tarika. So I'm a big believer of practicing mindfulness, and I know the term has been hyped and everybody kind of gets a little bit like almost creeped out by this term nowadays. Like, okay, what about mindfulness? How do I do it? The word kind of sounds very intimidating, but we have found fun ways to teach mindfulness. So through our Five Senses art program, we are reaching families to come together to do an art project and then giving them a taste of a mindfulness practice. It's been so well received. We have done really great events so far. We have one coming up soon where we are going to do succulent plants potting in a clay pot that people will be decorating, and then we will be conducting a mindfulness practice. The reason I have been so invested in teaching mindfulness to the community is because there's a lot of science to back up its benefits. It has been shown over and again that mindfulness can help reduce stress, anxiety, depression. It has been found to be effective in increasing attention span, improving concentration in kids. It has been certainly found to be very effective to improve your relationships, practice more empathy and compassion, and improve your communication skills. So the benefits are many, and there is science kind of supporting over and again. We are now understanding neuroscience kind of research is showing that practicing mindfulness in your day-to-day life can actually improve your neuroplasticity, your circuitry in the brain that can then become a source of resilience for you to deal with stress in day-to-day life. So I can do a whole episode on mindfulness and its benefits, but do check out our website for our upcoming events. We do mindfulness series for parents and tweens and teens, and we do this community event for families through our Five Senses art program.
Thank you, Dr. Leena. Even I do practice mindfulness, and I do feel I have cultivated many benefits. I'm very aware of my emotions, feelings, and I have become emotionally resilient over time, and I feel more happier, healthier. So I can relate with all the benefits you mentioned. So another question I wanted to ask you, what is your message for the parents who are listening to this podcast? Because they might be bringing a young woman, or that self-care you said, yeah, parents also need to take care. So any message for our parents?
Absolutely. I'm a parent myself, so I'm going to say that as parents, we are doing a lot. So definitely always give yourself a pat on the back. I'm raising a 17-year-old teen girl who's ready to go to college soon. So we go through a lot of testing times with her teens, whether it's a boy or a girl. But I have to say that if you have a teen girl, really important to try to join them where they are. Every kid is different. They have amazing potential, amazing personalities and temperaments that may often like throw you off because they roll eyes at you all the time. But I think amidst that like teenage angst, I would say try to find moments to connect with them, to have that nurturing relationship, to help them become a young lady that is empowered with a lot of love, with a lot of strength and education about how to take care of herself. Talk about your experiences with them. We think they are young, so we shouldn't burden them. But once they are teens, they are actually like your friends. So talk to them about your challenges in day-to-day life and how you're tackling those. Give them skills, give them empowerment to be assertive, to stand up for themselves, to reach their potential that they are capable of.
That's a wonderful message, Dr. Leena. So, any message for the teens who are listening to this podcast?
Well, I would say teens, as much as developmentally appropriately so, you think it all. I would request you guys to have an open mind, to listen to the wisdom your parents, your grandparents, your caregivers, the adult caregivers or your cheerleaders have for you. I know it may not make too much sense at this time, but listening at least with an open mind and getting the seed planted can be a really good thing that may sprout someday later on when you are like, oh, I'm struggling right now. And this pearl of wisdom from my parent is now coming in handy to solve the challenge I'm dealing with. I want to give a shout out to all the teen girls who are listening to this is that be proud of being a woman, a young lady, a teen girl, because we have so much more that we have been gifted with and that we can offer to the community. So celebrate yourself and empower each other.
Thank you, Dr. Leena. And I must say, I'm going to take some time to reflect on my own attitude, beliefs, and behavior about my self care and prioritize my well being so that I can help others. As you're saying, first take care of yourself and then take care of others. So it was an awesome conversation with you. I'm wishing everyone a happy International Women's Day. And remember, this day is not only one day to celebrate, this is an ongoing dialogue, action, and commitment to advancing women's and bringing gender equality every day of the year. Dr. Leena, thank you so much for joining us today.
Thank you so much and happy International Women's Day. Take care, everyone.
You are listening to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation. As part of our youth series, we will be releasing new episodes every Friday, so make sure to continue to check those out. We hope you enjoyed this podcast, and thank you so much for listening.